Hey guys, it's Leah B from Prestige Veteran Medical Consulting. I am a U.S. Army veteran, physician assistant, and former C&P examiner. So today I want to come on and discuss what happens in a C&P exam, compensation and pension exam for allergic rhinitis. So I've had a lot of positive feedback about this type of video because we've done several in the past, as it seems that this is kind of a confusing process for a lot of veterans, and they really just don't know what to expect when these exams are coming up. And I think it's a pretty transparent process. The VA does a great job, I think, of sending out packets of information on what to expect, but it can just be overwhelming, I think. So hopefully just having a very direct video about this will help you guys to kind of understand and navigate some of that, right? So just to also disclaim that this is not any type of medical or legal advice, right? I'm not an accredited claims agent or VSO. I don't assist any veterans with any type of advisement for the claims process. You should always check with a VSO or an accredited claims agent or attorney on stuff like that. But I just want to show you guys some of these resources that are available online so that you can kind of have a better understanding, right? So back to it. So allergic rhinitis. So let's say you have an exam coming up for allergic rhinitis. You get a packet in the mail from the VA that says, hey, you have an exam coming up. Here's the date for that exam. Here's the location. Here's who that examiner is going to be that you're going to see. They should tell you the name of the doctor or PA or nurse practitioner that you're going to be seeing. It should also tell you how long they've been doing these types of exams. If it's a doctor, they'll probably tell you what specialty they're in, whether it's, family medicine, internal medicine, pulmonology, or whatnot. Okay. So they also, a lot of times, what I've seen in the past, at least for my own disability claims process, I received an actual copy of the DBQ in the mail. I'm not sure if they're still doing that, but I'm going to show you a copy of this. I'm going to switch over to presentation mode. And this DBQ you can find on va.gov also if you have any questions. Okay, so let me pull this up so you guys can take a look at it. All right. Okay, so let me just blow this up just a little bit for y'all and start at the top. Okay, so this is the sinusitis / rhinitis and other conditions of the nose, throat, larynx, and pharynx disability benefit questionnaire. Okay, this is found on va.gov. You can also print off a copy and take it to your own treating provider, your ENT doctor or your regular family practice doctor, and ask them to fill out a copy if you'd like. So let's see here. This first page, as you can see, this is what the examiner should be filling out, something of this nature. Okay, so the name of or your treating provider, the name of the patient, your information. This is kind of information about you. Are you the doctor? Are they a VA healthcare provider? Are they regularly seen in your clinic? Was this person examined in person? You, the veteran, were you examined in person? Evidence reviewed. What did the doctor, the C&P examiner, review about you? Did they see your claims file? Did they see your private treatment records? Did they see your service treatment records, the date ranges? Okay. The diagnosis. Does the veteran now or have they ever been diagnosed with a sinus, nose, throat, larynx, or pharynx condition? Yes or no? So as you can see here, there's several conditions here. We're not going to go over all of them today. I wanted to stick with allergic rhinitis, but this particular DBQ goes over several things like chronic sinusitis, different types of rhinitis like bacterial, non-allergic, so on and so forth, right? Deviated nasal septum, etc. Other diagnoses that may pertain that weren't listed above. Okay, so section 2 here is going to talk about your history. So this is where you're going to discuss the history of your condition, when it started. Hey, you noticed that you had allergic rhinitis while you were in service, whether it was while you were deployed, after you returned from a deployment, maybe you never deployed, but you noticed it while you were working in the motor pool and you were around specific solvents, whatever. Maybe you had it before service. Maybe you're going to say it started when you were in childhood, but that it progressed for some reason while you were on active duty, whatever your history is. The next section, section 3, is going to be does the veteran have any of the following nose throat? Do you have any of the following conditions, right? Now, this section here is about sinusitis. So, okay, again, if you have rhinitis, it says complete part B below. Okay, we're not going to look at all these other sections because remember, we're just going to talk about rhinitis today. So we're going to skip over sinusitis. We'll do that another day. That's another common one though. So we're going to go to rhinitis. Okay, so this is where it starts talking about obstruction. Okay, so a lot of this goes into the rating percentages because it has to do with how much obstruction and how much the polyp size and things like that. Those are the things that go into that rating criteria that the rater is going to look at. So do you have 50% obstruction of the nasal passages on both sides due to rhinitis? Is there greater than 50% obstruction? Yes or no? Is there complete obstruction on the left side due to rhinitis? Is there complete obstruction on the right side due to rhinitis? Yes or no? Is there permanent hypertrophy of the nasal turbinates? Yes or no? Are there nasal polyps? Yes or no? Does the veteran have any of the following granulomatous conditions? Yes or no? And these are all very specific conditions, right? Wegener's granulomatosis, rhinoscleroma, things like that. Okay. The next section is not about rhinitis anymore. So we're not going to go over that section. And we're just going to skip to the sections that are going to be rhinitis again. Okay. All right, so this section is going to be related to everything, tumors and neoplasms. So if there are additional benign or malignant neoplasm or metastasis related to any of the diagnosis in the diagnosis section, describe using the format above, if that applies. Other physical findings, complications, conditions, signs, symptoms, or scars. So there's always usually some kind of question about scars related here on almost any DBQ. Let's say you had some kind of surgery related to your allergic rhinitis. This would prompt the examiner to do another DBQ related to scars in case that was connected. We have a great video on scars that you can check out as well. Again, this is more related to scars here. So diagnostic testing, okay? Have you had an MRI or a CT, X-rays? Has there been endoscopy done? So did any of your doctors do a scope previously, a nasal endoscopy to see what's going on up there? Have there been any biopsies? Pulmonary function testing of the upper airway due to laryngeal stenosis? That probably isn't going to apply to allergic rhinitis, but if you've had it done, then the examiner may put that in there. Are there any other significant tests? Functional impacts, like anything related to work. So if you work, let's say you own a lawn care business, and you have allergic rhinitis and seasonally, this is like causing you a tremendous amount of problems, that may be something to discuss here. Additional remarks, if the examiner has additional remarks, they're going to put them here and then they're going to sign it. So let me hop back over off of this screen. So after this, they're going to submit this and then the rater will probably take a look at it, or whoever is going to take a look at it to determine, what the findings are going to be. Okay. So I hope this was helpful to you guys. I hope that, that clears up some of what happens at an allergic rhinitis exam. There may also be a medical opinion that is requested. That's a separate document. And then they are asked whether they believe it's related to your service or not. And then the rater or the judge or whoever's looking at it is going to look at the totality of evidence and determine whether or not, they're going to weigh on that. Okay. So I hope this was helpful and thank you for watching. Please drop some comments and let me know if there are any specific questions you have or other videos that you'd like me to make. All right. Thanks, guys. Bye.